good morning, good afternoon, good evening, colleagues from all over the world. Welcome to the launch event of the Action Framework for Developing and Implementing Public Food Procurement and Service Policies for a Healthy Diet. It's a virtual meeting. We're very privileged to have with us our Director General, Dr. Tedros Ghebreyesus. He will give opening remarks. It will be then followed by Dr. Tom Frieden, the President and Chief Executive Officer, Resolve to Save Life. We'll then have the actual presentations on the action framework and a series of statements from organizations, governments that have actually implemented policies on public food procurements. So without further ado, I'd like to invite Dr. Tedros Ghebreyesus, our Director General, to give the opening remarks. Thank you, Dr. Tedros.
Grazie mille, Francesco. Dr. Tom Frieden, dear colleagues and friends, good morning, good afternoon, and good evening, and a very happy New Year to you all. Around the world, millions of people have begun the new year with a resolution to lose weight, get fit, and to eat a more healthy diet. Unhealthy diet remains a leading risk factor for death and disability globally. Around 8 million deaths every year are attributable to unhealthy diets, and another 8 million deaths are attributable to obesity and maternal and child undernutrition. Promoting healthy diets is critically important now more than ever as the world is continuing to face the COVID-19 pandemic. Healthy diets can help support the body's immune system, fight infections, and protect against all forms of malnutrition and non-communicable diseases. Every day, the health of millions of people is affected by the food and drink served and sold in public places such as government offices, schools, hospitals, care homes, prisons, and in nearby shops or stalls. Many governments also buy food for government-funded programs such as school meal programs. All governments, therefore, have the opportunity and the responsibility to prevent disease and save lives in the food they buy and supply. The action framework we are launching today provides governments with a tool for taking action to ensure a healthier food environment in all public meetings. My thanks and congratulations to Francesco and his team at WHO, and to Tom and your colleagues at Resolve to Save Lives for your collaboration on this very important product. There are 3 key ways in which we are urging governments to take action. First, lead by example. Governments can make a difference by serving and selling food that contributes to healthy diets. Public funds should not be spent on food that contributes to unhealthy diets. This requires strengthening or expanding policies for food purchased, served or sold in public settings, or developing new policies. Second, take a comprehensive approach. Buying and serving healthy food must be part of a comprehensive and coherent package of policy actions to ensure that food systems contribute to healthy diets. And third, support WHO's continued commitment to healthy diets. In September last year, WHO launched the second progress report on global trans fat elimination to support our global goal to eliminate industrially produced trans fat from the global food supply by 2023. The number of countries passing and implementing best practice policies is growing, with almost 600 million people globally now benefiting from such policies. WHO is also developing a global sodium benchmark to reduce the sodium and salt content of various food items. We face an enormous challenge, but we also have an enormous opportunity to improve the health and well-being of people all over the world. I would like to thank Dr. Tom Frieden and our friends at Resolve to Save Lives for their partnership and leadership on these issues. We look forward to our continued work together to make sure that food is a source of health, not a cause of disease, for people everywhere. I thank you.
Thank you very much, DG, and for your encouragement and enthusiasm. And I know that you're also very committed in WHO with the canteen we have and the offer of drinks. It's all in line with our recommendations. I'd like to remind everybody that you can access the translation. We have the 6 UN official languages. You should have the access to translation in the taskbar. You can also raise your hand and or also put in the chat on the Q&A any comments and questions you might have. There will be time towards the end for question and answers, so please anticipate your interest to come in. And I'd like to now join the Director General to thank Dr. Frieden, and would like to give him the floor. Dr. Frieden is the President and Chief Executive Officer of Resolve to Save Lives. The floor is yours, Tom.
Thank you very much. Good afternoon, Dr. Tedros, Francesco. It's great to be with you again, and thanks to all of the people who contributed to this event, and more importantly, to the progress that the action framework is going to trigger. I'll just say, big picture, there's a simple concept here. Government buys a lot of things, including food, and it funds other organizations to buy food. When it does that, it should follow its own guidance for healthy food, because the food that the public sector purchases, sells, or allows to be purchased or sold should not promote illness, because that is not in the society's interest, that's not in the government's interest. That's the essential concept behind this very important action framework. As you know, globally, unhealthy diets are a leading cause of preventable death and disability, resulting in very large economic and health costs for individuals, communities, and society, including healthcare costs and lost productivity. Around the world, millions, perhaps billions of snacks and meals are served to the public every day through institutions such as schools, government offices, healthcare facilities, military bases, and correctional facilities. This provides a great opportunity to improve the healthfulness of the diet of the population by ensuring simple concept that all food served and sold in these settings follows core healthy diet principles, including limiting sugar, reducing saturated fat, and eliminating industrially produced artificial trans fat, the WHO Replace strategy, limiting sodium consumption and ensuring that salt is iodized, increasing the consumption of whole grains, vegetables, fruits, nuts, and pulses, and ensuring the availability of free and safe drinking water. I've seen firsthand that this can really make a difference. When I was health commissioner in New York City, we issued an executive order that required every agency to follow standard policies. And this resulted in more than 3,000 programs serving more than 230 million meals a year, greatly improving the healthfulness of the food that they were supplying. This is one of those very few programs that actually did better in the implementation than we had anticipated when we launched it. You know, Dr. Tedros, we often launch programs and we have high hopes for them. This is one where we had medium hopes for them, and yet the actual implementation was very effective. In a review 10 years later, it was noted that this caused widespread, concerted, multi-sectoral action covering education, health, mental health, corrections, aging, and others. This really was the trigger for our engagement on this issue. Our core concept at Resolve is scale. Not pilot programs, but scale. How do we help the most people? And the WHO action framework can help get this done around the world. Governments should not be paying for or subsidizing the consumption of unhealthy food. It's a very simple concept. All public funds for purchasing and providing food should be used to promote healthy diets across the entire population. The action framework gives governments a guide to developing, implementing, monitoring, and evaluating a healthy public food procurement and service policy. It offers clear, actionable steps that governments can take to ensure a strong policy with the best chance of improving the nutrition quality of meals and snacks offered in government settings. The document guides the development of a comprehensive policy that goes beyond just the procurement of food and includes the entire process of purchase, subsidy, provision, distribution, preparation, service, sale, and communication about healthy food in public settings. The action framework calls on governments to develop mandatory nutrition criteria for serving and selling fresh and healthy food and limiting or prohibiting the availability of unhealthy food, particularly salty packaged snacks and sugar-sweetened beverages. The criteria, importantly, can also strengthen local food systems, such as local farming communities, by encouraging purchase from local sources and taking other sustainability criteria into account. For maximum impact, the procurement policies can build on, complement, or even incorporate other policy action that promotes healthy diets, such as restrictions on food marketing to children, subsidies on healthy food or other food pricing policies, and harmonizing nutrition criteria with front-of-package warning labels, a best practice that's emerging from Chile and elsewhere. So I really want to thank Dr. Tedros, Francesco, Chizuru, the whole WHO team, and the countries and communities from around the world that have been forging a way forward on this. And I'm looking forward to the rest of the session. Congratulations. And I look forward, just as Dr. Tedros, you mentioned the second annual report on Replace. Maybe we'll have the first annual report a year from now on the adoption of this policy framework in countries and communities around the world. Thank you so much.
Thank you very much, Tom, and thank you very much to all the Resolve to Save Life teams for excellent continued collaboration. And I must say this action framework is a response to a request that came by the World Health Assembly to provide some guidance, particularly in the school context, but in general on public food procurements. And next week at the Executive Board of WHO, the document on non-communicable diseases will also contain a summary of what the situation is and what this document is going to contribute. And then, importantly, the best buys of non-communicable diseases included a reference to the need to have some guidance on public food procurement to reduce sodium. And this is what I would like perhaps to ask Dr. Chizuru Nishida to speak about. She's the unit head of Safe, Healthy and Sustainable Diet in the Department of Nutrition and Food Safety here in WHO headquarters. Chizuru, please.
Thank you, Francesco. So I would like to just give the quick background and put this in the context. As Francesco, next slide, please. As Francesco mentioned, why, there has been a question, why action framework on public food procurement and the service policies. Again, it originated from it was prompted by this action for reducing sodium intake. As everybody knows, that in 2013, the Global Action Plan for Prevention and Control of Non-Communicable Disease was adopted, and this contained the appendix which identified effective interventions. In 2017, there was updates. This was reiterated by Tom and then also now by Dr. De Branca, Francesco, that there were 4 best buys related to promoting healthy diets. One of which is the development of, or the implementation of public food procurement, or creating enabling environment, supporting environment in public settings. So next slide, please. I would like to just also give a bit of contextual background in terms of WHO's work related to the sodium the reduction. And it's a lot of information here, but as I would like to just highlight. The left-hand side, I listed up the scientific advice and the guidance work we have done in the guiding the sodium intake. And then the right-hand side, there is some political, the policy influencing that the WHO has contributed to. And scientific advice and the guidance area, I would like to just highlight a few. The first recommendation was developed by the WHO study group in 1989. At that time, it was less than 6 grams of salt per day. And in 2002, it was reduced to less than 5 grams. And this was also in consultation with the iodine deficiency, the community that WHO was promoting the salt iodization. There is no contradiction in both the salt reduction strategies and IDD actions. And this, in fact, and then the 2012, the most recent guidance that the WHO developed, the recommendation remained as less than 5 grams of salt and less than 2 grams of sodium. However, this was for the first time not the population average, but rather the individual recommendations, meaning then, in fact, if you really calculate that, the population level intake should be much less than 5 grams of salt. So then I would like to just highlight the fact that this 2002 expert consultation, this served as a scientific basis for developing, WHO to develop the 2004 Global Strategy on Diet, Physical Activity and Health. And this then prompted also the Codex community to look at the NCD issues when developing guidelines, not just food safety issues. Food safety issues is very critical and continue to be so. However, now the global change and the dietary change is required. The guidelines which Codex is developing should also take into consideration of the NCD prevention issues. So in 2013, the sodium became mandatory nutrients to be declared as together with the total sugars and saturated fat. Moving on, the 2018, the 13th General Program of Work, which is guiding WHO's work, is also highlighting the intake, the reduction of sodium to be very critical in order to achieve healthier populations. Now, next, please. The Director General, in his opening remarks, called attention to the member states to do 3 things: lead by examples, the 2, they take comprehensive approach, and 3, they support WHO's continued commitment to healthy diets. In order to support this action, the call for action, WHO is also doing its part. We are developing scientific advice and guidance related to improving food environment and promoting healthy diets. There's various the guidelines are coming up throughout this year, and also other guidelines related to improving nutrition in particular. And in order to also support the translation of these guidelines and policy actions which are being developed, we are also developing various implementation tools. Action framework, which we are launching today, is one of them. And so then, bringing this together, we will also be facilitating this call to action that which the Director General highlighted in his opening the remark. Thank you very much.
Thank you, Shizuru. And I think we've built enough suspense. And now we have to tell you about what the tool is about. And I'd like to give the floor to Ms. Kaya Engesven, the Technical Officer of the Multi-Sectoral Action in Food System team in our department. Kaya, over to you.
Thank you very much, Francesco. And good morning, afternoon, and evening to everyone. I will give a brief introduction to the document being launched, the Action Framework for Developing and Implementing Public Food Procurement and Service Policies for a Healthy Diet. Next, please. This action framework is a tool for countries aiming to make public food procurement and service healthier. It is organized around a typical policy cycle and gives guidance for countries to take when preparing, developing, implementing, monitoring, enforcing, and evaluating a healthy public food procurement and service policy. It includes a number of examples from countries around the world that have worked on such policies. And throughout, it points to resources and tools that can be used from WHO and from partners. And we in WHO think that this framework can complement the ongoing work of partners in this area. I will take you briefly through the steps under each of the 4 phases of the policy cycle. Next, please. But before that, just let me take a brief moment to reflect on how this action framework defines a healthy public food procurement and service policy. Next, please. By healthy, it is referred to the core principles of healthy diets, which were also mentioned by Dr. Tom Frieden earlier, meaning that the policy seeks to prohibit or limit unhealthy foods high in sugars, fats, and salt, while encouraging healthy foods and safe drinking water. Next, please. With public, it is implied that the food is purchased with government funds or served and sold in a public setting. Next, please. And by food, we refer to any types of food, beverages, ingredients, meals, or snacks that might be covered by the policy. Next, please. And by procurement and service, it could refer to any part of the process, from purchase and subsidy to provision, distribution, service, or sale of food. Next, please. And by policy, it could refer to any national document used for this purpose in a country, which could be both mandatory or voluntary. So bearing this in mind, let's turn to the policy cycle. Next, please. During policy preparation, the action framework guides countries on identifying public health priorities and spelling out how healthier food will help achieve national goals, as well as determining who will be involved in the policy development, bearing in mind that a successful public food procurement and service policy requires buy-in from government as well as a range of non-governmental actors. This, of course, requires clear rules of engagement with different stakeholders in order to prevent and manage conflict of interest. The framework guides countries on how to conduct an assessment of the public food procurement and service landscape in terms of mapping where, what, and how food is purchased, served, or sold, and the existing policy landscape. Identifying opportunities to strengthen or expand policies in place or under development can help find the entry points to make public food procurement and service healthier. And lastly, advocating for political buy-in and building support for the policy, where the framework suggests advocacy activities to get support from different audiences. The section on policy development guides countries through the process of defining the purpose and scope in terms of which settings, venues, and types of food to be covered, as well as the policy objectives addressing both the desired long-term health impact, such as reduction in obesity, as well as the shorter-term immediate outcomes, such as changes in the cafeteria menus, which is important to mitigate eventual challenges that the policy might be ineffective. Setting nutrition and other criteria is a central element of this action framework, and I will come back to the concept of nutrition criteria on my next slide. But in addition to nutrition criteria, countries may also set other criteria for safer, more sustainable, or more local food production and procurement and service. In addition to the public food procurement and service policy, countries may consider complementary actions to ensure policy coherence, such as nutrition labeling or marketing restrictions, while conducting transparent consultations with stakeholders on policy options will help secure buy-in for a feasible policy approach. When finalizing the policy, monitoring and enforcement mechanisms are defined and timelines are established for when the policy will come into effect. And lastly, already during the policy development phase, countries should begin the planning, costing, and identification of resources that will be required. Next, please. The framework guides countries in establishing nutrition criteria to define the food to be encouraged, limited, or prohibited in public food procurement and service. And we often talk about 3 types of such criteria. First, nutrient-based criteria are based on nutrient content in a specific food category. For example, a maximum permissible amount of sodium per serving size. Useful resources include the WHO regional nutrient profile models, which have been developed in all 6 WHO regions, and the WHO Healthy Diet Fact Sheet. The food-based criteria are based on defined food categories. For example, a prohibition on food items typically high in sodium. Useful resources include national or regional food-based dietary guidelines or the WHO 5 Keys to a Healthy Diet. Other nutrition-related criteria can be developed that target the preparation or service of food, such as cooking methods, portion sizes, placement of food, or menu labeling. For example, a prohibition to place visible salt shakers in the cafeteria. Next, please. During policy implementation, the framework guides countries on developing and periodically updating detailed activity plans and how to overcome bottlenecks, making the new policy widely known through suggesting communication strategies to reach different audiences, integrating the policy criteria into new and existing contracts, considering the training and technical assistance needed for staff and other actors, and developing materials and tools such as guides, recipe books, or food catalogs that will support different aspects of implementation. Next, please. As part of monitoring, enforcement, and evaluation, the framework guides countries on setting up new or expanding existing mechanisms such as inspections or platforms for receiving complaints. It also discusses how to determine where, what, and how to monitor for ensuring compliance, and describes various kinds of sanctions and rewards that can be employed in order to act on compliance and non-compliance. Evaluating both the policy process and outcomes is important to identify the challenges, barriers, successes, and enablers of implementation, and to understand the policy effects, and specifically if objectives have been met. Communicating the results of these monitoring, enforcement, and evaluation activities and making reports widely available will help foster learning and corrective action. And finally, the framework suggests periodically revisiting or revising the policy to close loopholes and to make necessary updates. Next, please. We will work with countries that want to make their public food procurement and service healthier. Many countries already have food procurement and service policies. For example, in the report to be presented at the Executive Board next week that Francesco mentioned, WHO has information that 86 countries have measures for food served or sold in and around schools. Such policies can be strengthened or scaled up in terms of geographical area or the type of settings covered, by strengthening nutrition criteria or by developing mandatory measures. Most countries also have committed to promoting healthy diets in their national policies, and often with policy goals to reduce consumption of specific critical nutrients. For example, 155 countries in the WHO Global Database on the Implementation of Nutrition Action already have sodium reduction-related policy goals. Introducing healthy public food procurement and service policies can be one way to operationalize and reach those policy commitments. Next, please. And while I'm presenting the document here today, there has been a full team behind it, involving a number of colleagues in WHO and Resolve to Save Lives. Thank you very much for your attention.
Thank you very much, Kaya, and thank you to the team who has produced this work. But I must say particularly thank you to those member states, those institutions who have been implemented public health procurement policies in line and supportive of healthy diet. And without this wealth of experience, we wouldn't be able to produce a document like this. So really I would like to acknowledge all the experience around the world, and we would like to hear from some of those institutions. We have 4 short testimonies of that from New York City, from Denmark, and also from 2 of our sister organizations, very engaged in the provision of food in schools, UNICEF and the World Food Programme. So we'll hear now from Ms. Christine Johnson-Curtis, the former Assistant Commissioner of the Bureau of Chronic Disease Prevention and Tobacco Control of New York City Department of Health and Mental Hygiene in the USA.
Hi, I'm Christine Johnson, and I was involved in the creation and implementation of food procurement standards in New York City agencies. As a first step, we convened a work group of all city agencies that purchased and served food It was chaired by the mayor's office, with the health department staff serving as technical advisor. We met with each agency individually to collect information about how food was purchased and served, and also the unique needs of the population. Once the standards were drafted, we reviewed them with each agency and revised them based on their feedback. The standards themselves are unique. They include 3 component parts. The first are purchased food standards. These are nutrient thresholds for specific categories of foods, such as breakfast cereals and processed meats. The second are meal and snack standards. These are nutrient thresholds for the overall daily intake for all meals and snacks served, consistent with national guidance. And the third component is a population-specific standards. These are specific nutrient thresholds or guidance based on the population that's served, such as seniors. The New York City Health Department found that there were 3 key aspects that ensured successful implementation. They were technical assistance, contract management, and public reporting. In terms of technical assistance, registered dietitians and other health department staff met with each agency to conduct menu analysis and review product lists. They also conducted trainings, ultimately training over 1,000 city staff. And they developed complementary materials, such as implementation guides and posters and fact sheets to fully explain the standards and how to implement them best. In terms of contract management, Health Department staff also trained contract managers at every city agency to ensure that the standards were included in all contracts going forward. And finally, in terms of public reporting, the Health Department collected information from each agency every 6 months to assure progress on each individual standard. And then now there's an annual reporting requirement and public reporting on the City Hall's website. In New York City, we found, based on menu review, that sodium decreased overall, trans fat was eliminated, and water replaced sugary beverages. The toolkit you're discussing here today provides many of the same components that made the New York City implementation so successful. It includes information on technical assistance, public reporting, and developing appropriate standards. It's not only useful just at the country level, but can be used by other jurisdictions, such as other cities, just like New York City did. We found that public food procurement was a low-cost, feasible way to improve the health of the population while also modeling healthier eating for all.
Thank you very much, Ms. Johnson. And you'll see, this is the document. It's available on our website. It has indeed a lot of very concrete information. The challenge is the implementation. And of course, each context will be different to that regard. That's why the experience such as the one of Denmark is so interesting. We are going to hear from Ms. Bettina Bergman-Madsen of the Copenhagen municipality. And the experience is really of creating a network of food procurement officers. The floor is yours, Ms. Bergman.
Thank you for giving me the chance to say a few words at this launch event for the very important written words in the action framework. In Denmark, I have been working as a chief procurement officer in the municipality of Copenhagen since 2009 with the responsibility of all the public food procurement to children, elderly, and social vulnerable people. Alongside, I have been working with the Danish Ministry on how to implement the European Green Public Procurement Guidelines, also called the GPP criteria, into a Danish context. And on this occasion, we decided to create a network of food procurement officers in Denmark. In this network, we have made a baseline questionnaire on how many knew the GPP criteria and on how many worked actively with sustainable criteria in their procurement. And I must say that the results was not very impressive. But now already 2.5 years later, we can see that there has been great improvements. In Denmark, we can see that it has been crucial for the implementation of the GPP criteria that we established the network, and it will also be very important for the spreading of this fantastic action framework. I have also just joined a cross-European GDA Sunday-led joint action program called Best Remap, where I am in charge of establishing a European procurement network And the goal is to encourage all countries in this network to create their own national networks, and having each national person in charge of these networks meeting on once a year on a European level to share great ideas on how to procure for a healthy diet that is also sustainable. My greatest wish, though, is that all countries at a national create national networks, and that the chairman of these networks meet once a year at a regional conference to share ideas, and that the person in charge of these regional networks will we could call them, for example, ambassadors. So the European ambassador for public food procurement once a year could meet with ambassadors from other continents and share latest news on sustainable food procurement. In this way, we could really implement changes so much faster. But for now, I will bring the action framework to life in the Danish national network and in the new European network. And in years to come, we can follow up on how it has been implemented through the yearly questionnaire that we make in these groups. But for now, thank you for listening for me, and I look so much forward to the rest of this event and to the great work that lies ahead of us. Bye for now.
Thank you very much, Ms. Bergman, and we're very pleased to hear that this is going to be generating action. We've also heard very interesting commitment by other countries such as Germany, that in collaboration with Sri Lanka and Brazil has announced to establish a global network on school food procurement. So we look forward really scaling up all this work. And now I'd like to give the floor to my colleague and friend, Ms. Vilma Tyler from UNICEF.
Dear friends and colleagues, I would like to start by wishing you a happy and healthy new year. I would like to extend my thanks to WHO and Resolve to Save Lives for organizing this event and inviting UNICEF, and I would like to congratulate you on an excellent guidance. Today's discussion is an important reminder that we still need to scale up action around the world if we are to meet global targets to halt the rise in childhood obesity. The vision of the UNICEF's New Nutrition Strategy 2020-2030 is a world where all children, adolescents, and women realize their right to nutrition. This vision is guided by the Convention on the Rights of the Child, which recognizes the right of every child to adequate nutrition. Governments worldwide have primary responsibility for the protection, promotion, and fulfillment of children's right to nutrition. Through our work at country level, UNICEF advocates for and supports governments in developing a package of policies and strategies that promote nutritious, safe, affordable, and sustainable diets for children. An increasingly important component of our work is efforts to improve children's food environments, including in schools and surrounding areas like public spaces, eating outlets, community and leisure centers. These settings need to offer nutritious options while limiting access to unhealthier ones. One way that they can do this is through the implementation of healthy public food procurement and service policies, as described in the new guidance to ensure that all food and beverages served or sold in public settings where children gather contribute to the promotion of healthy diets. As such, this guidance is an extremely valuable tool for implementing partners such as UNICEF, who work on the ground with governments. The challenge of ensuring healthy food environments for children is a universal one, and a challenge that is increasingly relevant to all countries, high, middle, and low income. The difference is that many low and middle income countries are doing this against the background of a triple burden of child malnutrition. So the challenge is in many ways greater and more complex. With these short remarks, welcoming this new WHO guidance, I'd like to leave you with a couple of brief reflections and challenges to all of us to ensure this guidance leads to real-world changes and impact. The first is, how can we work together as a community to provide countries with the capacity building and implementation support that they will surely need to implement, enforce, and sustain the changes recommended in this guidance? The second is, how do we ensure that this agenda is framed as part of the response to all forms of malnutrition? Too often, such policies are understood to only be part of a response to overweight and obesity or non-communicable diseases, when in reality, they are about better quality diets and as part of a package of interventions will contribute to tackling multiple forms of malnutrition. UNICEF is ready to support WHO in this. Thank you.
Thank you very much, Vilma, and we're really privileged to be part of the broad UN family. In fact, in nutrition, we have one secretariat called UN Nutrition, which is chaired by Dr. Yamamoto, who is next to me. Now I would like to give the floor to Linda Keys, who is the Chief of Nutrition Integration Team at the Nutrition Division of the World Food Programme.
Good morning, good afternoon, good evening, colleagues. It's great to be able to join all of you virtually in early 2021. The action framework for developing and implementing public food procurement policies for healthy diets comes at the right time. As you know, even before COVID-19, it was estimated that 3 billion people across the globe could not afford a healthy diet. Unfortunately, the pandemic and its socioeconomic effects are only set to worsen the situation, especially for vulnerable families in fragile settings. WFP works together with WHO and other partners across nutrition-sensitive programs and procurement with the aim of preventing all forms of malnutrition. Our programs, such as social protection, smallholder farmer production and markets, and school health and nutrition, have a wide reach in ensuring that food policies, procurement, and market linkages promote healthy, sustainable diets. Broadening nutrition-sensitive action continues to be at the core of WFP programming aimed at improving availability and access to healthy diets, particularly for vulnerable populations across the life cycle. Partnerships are at the core of our work. We are working hand in hand with governments, UN agencies, and other partners to bring synergies at the national level where policies tend to be fragmented and fail to safeguard the public interest in improving diets. In some countries, WFP directly implements its programs, and in others provides technical assistance to support governments with institutional procurements, affecting and informing food policies. Furthermore, we're also working with the private sector actors who have a crucial role in building sustainable food systems that can deliver healthy diets for all. This action framework complements WFP's local and regional food procurement policy of 2019, which aims at scaling up our efforts to promote and influence healthy diets and nutrition-oriented behaviors, especially in the most fragile and hard-to-reach remote areas. Congratulations to WHO on this important work. WFP is committed to supporting the implementation of this action framework. Thank you.
Thank you very much, Ms. Keys, for this. And by the way, congratulations. The World Food Programme, as you know, has been awarded by the Nobel Prize for Peace. And clearly, the incredible work done in the provision of food, particularly healthy food, and particularly in certain contexts such as schools, is definitely a very good reason for that, and particularly during this difficult year of 2020, with such an increased number of people in need of food aid. So we have now a few minutes for questions. I have received a couple of questions in the chat about the needs of certain nutrients, sodium, what we say about high fructose corn syrup. The document we're discussing today refers to the WHO guidance on healthy diet. So the answer to those questions are actually in our guidance on sodium, in our guidance on free sugars. So we're not going to talk about that today, but clearly this document that we're discussing today is based on the latest scientific evidence on what a healthy diet means. We have received a question from Bhutan, and I'll read it. How will this framework benefit countries like Bhutan when there's no public food procurement system framework in place? Is some agency going to prepare one for Bhutan? Or should the Department of Trade be one of the main stakeholders for successful implementation of the framework? So what happens in a country that does not or cannot yet afford to do this? Dr. Nishida, you would like to respond to that?
Thank you, Francesco. Maybe I will start, and then if Kaya has additional information, maybe she can come in as well. I think, thank you very much for the questions, and I think it's really it's opportune, really opportune time that if the Bhutan does not have currently the specific the guidance or the policies on public food procurement or service, perhaps this action framework can serve as a basis for you to start taking action, bringing together different agencies or different departments. Of course, that the trade departments which is mentioned should be part of that. And as Kaya has mentioned in her presentation, the action framework provides the various steps in which we very much hope that the government will go through in considering developing effective action frameworks. So, the public food procurement policies. So we very much hope that for those countries like Bhutan who has not yet really formulated any specific policies, that this action framework could serve as a sort of tool to start the actions.
Thank you.
I will
Thank
also hand over to Kaya. Kaya would like to say something, or no, it's okay?
I have another question for Kaya, actually.
Okay.
No, I just want to add that there is an opportunity this year because of two important events, one a food system summit and the other one the Nutrition for Growth Summit. These are both events where we want to see commitments. So, new policies around public food procurement, this would be definitely a good game-changing solution to be developed by governments and to be presented at this summit. The question I have for Kaya is how much budgets and time is being spent on consumer education, for example, in public schools where students learn science, math, and social science. Would be it wise to teach nutrition too? So what can you say about school programs and education as part of school programs?
Thank you very much for that question, Francesco. Nutrition education is, of course, a very important part of a comprehensive school nutrition package, which should consist of not only like the food being served or sold, but also what information is giving about healthy diet, about preventing all forms of malnutrition, and not only obesity and diet-related non-communicable disease, but also like related actions. Hand washing, for example, is very important. Use of iodized salt and growing vegetables could be relevant in many regions. So education is one part of that and is very important. The exact budget for that will, of course, depend from country to country, but it's definitely part of an important package. So in such a package could be like the components that we also promote through the Nutrition Friendly Schools initiatives. So firstly, to have a policy widely for the school, and then second, to reach out to the communities, and third, to have these nutrition curriculums and education part, and fourth, to ensure the healthy environments, including to promote the healthy diet in the environment. And then fifthly, also to have nutrition services provided through the school health services. Thank you.
Thank you, Kaya. And perhaps a follow-up question. Are we going to have a WHO online course? Do you want to comment on that, Kaya?
Was that on nutrition education? Yeah. We don't have any particular plans to have an online WH course on nutrition education. For nutrition education in schools, we also work very closely with, like you said, our UN partners that you mentioned before. And this is particularly an area also that we work very closely with FAO, who have been doing extensive work in this area and have developed various reports and resources on that. So we are working together on that and very much supporting those efforts. Thank you.
Thank you, Kaya. And I have a question for Dr. Nishida now. Does the document address conflicts of interest and industry interference in order to assist governments in the design and implementation of healthy food procurement policies? Because you have to deal with the private sector in establishing public food procurement. How can we ensure this is always done in the public interest? Is there any way?
Thank you, Francesco, and thank you for the questions. Yes, definitely that we did take into consideration of this conflict of interest issues in the different policy cycles that the document clearly addresses those issues. So I very much hope that they will be the people who are interested in implementing this, developing the policies and implementing the actions would follow this action framework very carefully. But yes, definitely, it is. We haven't forgotten, and it's a very important part of the action throughout the policy cycle process.
Thank you. And a follow-up question to the one that asked by Bhutan. So how are we going to address the implementation of this framework? So how do we envisage to roll out to countries at national and sub-national levels? And will WHO be monitoring how countries are adopting the framework? Kaya? Okay.
Yes, we will work with the countries to support the rollout of this document. And of course, like we do, to provide technical assistance through the different parts of the policy process as will be required. For monitoring the implementation, we do conduct global nutrition policy reviews. That is an extensive questionnaires being sent out to countries on all different forms of malnutrition. And this information is also then published and uploaded to the global database on the implementation of nutrition action, the GINA database. Thank you.
Thank you. And there's an important question about also inequalities. You know, how is there any idea on how to address inequalities? And Arya Kusuma says, particularly in this pandemic situation, there have been some low-income families who have been affected in developing countries, and there's no adequate social protection system to support them. Does this framework have any provision for low-income groups?
Yeah, this is also a big concern of us, and we recently had a joint statement with sister agencies where we called for attention to the many school children that were actually losing school feeding in these times of pandemic. So we really see that. This document supports the development of national policies that would take into consideration such as equity and would apply to all children and also addressing the vulnerable. Thank you.
Thank you, Kaya. And hopefully this will inspire also social protection policies. The investment that is done by governments on social support system is very large. So clearly having this investment by healthy diets is going to be a major contributions for the welfare of all population. I'm afraid we'll have to wrap up at this stage. And before closing, I really would like to thank all the speakers for the interesting presentation, all those who listened. And I'd like to give the floor to Dr. Naoko Yamamoto, the Assistant Director General of UHC, Universal Coverage Healthcare Population here in WHO. And as I said, she's the new chair of UN Nutrition. Over to you, Dr. Yamamoto.
Thank you, Francesco. And yes, it is a very important launch event is coming now to end. So first, I would like to deep appreciation with our dear partner, great partner, Dr. Tom Frieden. And also I would like to thank the representative of New York City, Denmark, UNICEF, and WFP to sending a message. And let me thank our team. Of course, DG, but also Francesco, Chizuru, Kaya, and the other all teams to work for it. Thank you very much. As the DG Tedros highlighted, government can lead by example, learn, and make difference by serving and selling food that contribute healthy diet. And the government have the responsibility to ensure the public funds are not spent on food and beverages that contribute unhealthy diets and dietary practice. Furthermore, action to ensure the healthy public food procurement and services should be part of the comprehensive and coherent package of policy action to improve food environment and promote healthy diet. During the Q&A, this is very encouraging questions, I think. And not only the government or policymakers, many audience raise the issues that NGO or civil society, voice of the community, and the academic institute can contribute to encourage the government to create a good policy. And in terms of the health equity or inequality issues, as Francesco summarized it in our comment, but role of the public food procurement and services can contribute a lot about to improve the inequality in many ways by providing services or buying food, but also public sector has many mechanisms to support create social protection. WHO is committed to part and is committed to support countries to improve food environment and to promote healthy diet. Sharing with the launching the action framework today, as during the discussion, Francesco and Chizuru-san has already mentioned a little bit, but WHO is planning to issue first a number of updated evidence by dietary guidance to prevent obesity and diet-related non-communicable diseases, including global sodium benchmark for different food categories. Second, policy action guidance to improve food environment. And third, various policy and guideline implementation tools leading up to the Food System Summit in September and Nutrition Summit in December. So please join us to call to action to making public setting healthier through implementing healthy public food procurement and service policies. So thank you very much again for all of you to join us at this launching event. Now I'm happy to close this launching event. Thank you again. Thank you very much.
Thank you.